One of the things that is becoming increasingly clear is that patients with COVID can also develop cardiac phenotypes. We've seen this many times. There was a paper in the New England Journal, for example, this week that have shown that patients with COVID can present with what look like ECG changes, with ST elevation, myocardial infarction, and so forth. And it's very difficult to differentiate true STEMIs from myocardial injury associated with COVID. And some of the things to look out for may be the presence of reciprocal changes on the ECG, as well as regional wall motion abnormalities on echo. Cardiac involvement with COVID infection is increasingly recognised. There have been 2 papers in JAMA Cardiology recently which suggest that the rates can be anywhere from between 20 and 30%. Now, this is important. Why? Because if you look at the mortality rates from these case series from single centres in Wuhan, mortality rates are close to 50% in patients with cardiac involvement as defined by an elevation in cardiac troponin. And there seems to be a very close correlation between troponin levels and inflammation markers such as CRP, as well as BNP, suggesting significant LV dysfunction. Whether this cardiac injury is an initial myocarditis is a possibility, or whether it relates to cardiac dysfunction and myocardial injury following the cytokine storm that is often seen in patients with COVID, particularly those at the very severe end that end up going to hospital. So I think that this COVID pandemic has really impacted on our healthcare systems. I think that we're going to see a huge impact on presentations with cardiovascular disease, both in terms of missed opportunities, so patients being frightened to come to the emergency department and therefore not receiving optimal care, through to increased risk of incident cardiovascular events triggered by viral infection, and finally cardiac involvement with infection associated with the COVID virus. So thank you for joining me, and let me know if you have any comments below. Thank you.